Obesity has quickly become one of the most pressing global health issues. All over the world, it is seen in varying severity, and today I'll be discussing the obesity epidemic in the US, the UK, China, and how their healthcare systems have addressed it in recent years. Starting around 1980, obesity has globally affected men, women, children, people of all ages and ethnicities. It is important to note that in many places, including the US and UK, African American and low income communities suffer the most from obesity. Before going further, we must understand what obesity is. Obesity is quantified and measured by a BMI or body mass index. This is calculated by dividing weight by height squared. A BMI of 30 or above is globally recognized as the benchmark for obesity. How does one become obese? Obesity is a very complicated issue and must not be attributed to just one factor alone. Obesity can be caused by genetics, exercise habits, diet, cultural factors, environmental factors, and many more. The sudden growth of obesity is not fully understood, but it is believed that the abundance of carbohydrates, processed foods, and sugar that were introduced into diets at this time was a large piece of the puzzle. In China, this is referred to as the westernization of their diet. What are ways that obesity can be addressed? There are several approaches to fighting obesity, which include education, reforming approaches to nutrition, improving infrastructure, increasing availability of nutritious food, and various methods through healthcare. It is important to note that the efforts I previously mentioned are hindered by the cultural factors of these countries, including diet, but also the perception of obesity. In these countries, obesity is not regarded as disease and is not seen as a health issue, but rather a cosmetic one. Expanding upon the role of healthcare systems, obesity is best addressed through routine check-ins with doctors. This allows physicians to catch major issues with obesity and prevent major chronic illnesses. It is both cheaper and more effective to prevent issues than it is to treat them. Healthcare systems worldwide are also known to perform surgeries and prescribe medicine to combat obesity. However, this care is expensive, and the opportunity for people to have access to this care is dependent on their country's healthcare system and their own ability to pay. When it comes to healthcare, the US isn't great. Unlike the UK and China, there's no universal coverage, and instead, care is administered based on an individual's ability to pay. There are approximately 26 million uninsured Americans that do not have access to the aforementioned care for obesity. The US spends the most on healthcare by significant margin, spending nearly twice the percent of GDP than that of the UK and 3 times that of China. Despite this, the US still leads OECD countries in obesity, showing that more expensive care doesn't equate to better outcomes. The US system's focus on acute care rather than preventative is problematic because obesity is best addressed through routine check-ins with doctors. The American system, however, is more geared towards treating patients once issues arise, say a heart attack or stroke in the case of obesity. When looking at healthcare in the UK, the NHS excels in many areas where America's system does not. Most importantly, the NHS provides free and equal care at the point of entry. Patients in the UK see their doctor much more often than patients in the US, providing more opportunities to catch obesity. As previously stated, obesity is an issue that disproportionately impacts lower income communities. The universal health insurance offered by the United Kingdom and China allows people in rough financial situations to see a doctor and treat their obesity, a reality not lived by those in the US. Despite all of the wonders of the NHS, the UK still struggles with obesity. Although the prevalence of 25% is far below America's 42%, there is still the second most obese OECD country. 1 out of every 4 males and females are obese in the United Kingdom. Similar to the UK, the Chinese government offers health insurance and covers 95% of the population. However, what is troublesome about the Chinese system is that it does not recognize obesity as a disease and is concerned only when chronic illnesses arise, similar to ideology in the US. China has an obesity prevalence of 14%. This is remarkably lower than that of the US or UK, however still troublesome considering this is triple that of what it was in 2004. Unlike in the US and UK, the more wealthy regions are more obese than the lower income areas in China. With obesity projected to increase in 2030, it is clear this issue is beyond the scope of healthcare by itself. As previously mentioned, obesity is a complex issue and in this case requires a complex solution. Work in other sectors have been done in these countries, but not to much avail. Regardless of the attempts to address obesity, whether that be through healthcare or policy, there is yet to be significant progress. Trying to fight obesity through these interventions requires a seemingly endless effort, and as previously observed, they might and likely will prove to be ineffective. There is no one solution to obesity, and the answer lies beyond that of just healthcare or policy. This must be solved through an approach that considers social, cultural, and environmental factors, in the words of Michelle Obama, one that touches on every aspect of how we live and how we work.